student?
Yes, I'm trying to share from my system, but the network is closed. I'm using MTN, I'm using Airtel. So my system has Airtel, my handset has MTN. So I want to share this from my phone to Ajara so that she can share to you. We're having terrible network these days. I don't know why. So just be patient a little bit. You will get the slides shortly. Ajara, you must have received it by now. Have you? Hello, Ajara, have you received it?
No, I haven't, ma'am.
It's showing me delivered.
No, I haven't.
Is it email or where is or
It's
on
WhatsApp.
It's WhatsApp.
It's WhatsApp message. Okay,
it's showing me delivered. Check.
I'm on. My phone is with me now. Okay, it just dropped. It just dropped now.
Check. It has delivered.
It has dropped. It has dropped. I've shared it.
Okay, I thought you want to help us share it on the screen here.
No, I'm sharing it.
I want her to send it to you.
You said?
I want her to send it to you. It's delivered to you, Ajara. Please share.
Yes, I've shared it. I've shared it. Everybody has it now. Check the WhatsApp there.
So, okay. So what I will do is to speak to the slides while waiting for Zoom to connect on my laptop. So you have the slide with you now, and I'm going to try to connect to that is slowing down the process when Zoom connects on my laptop. So you have the slides with you now. So we go on. So we are taking day 1, session 1, occupational health and safety. Please look through the slides with you while I attempt to connect via Zoom on the system. So occupational health and safety session, day 1, session 1. I am on slide 2. Definition of occupational health and safety, that is the course overview. Scope of occupational health, definition of occupational health and safety, what are the core principles of occupational health and safety, WHO role in promoting occupational health, International Labour Organization's role in promoting occupational health. So, slide 3. Are we together?
Yes, we're together, ma'am.
All right.
But the slide has not been shared.
The slide has been shared now. Ochaka acknowledged it.
From my end, I have not seen it. Thank you.
It's on the WhatsApp group.
Go to our group.
Go to our
WhatsApp group.
It's there on our private WhatsApp group.
So I'm on my system now, so we can do slideshow now. Right. So I have disconnected from the phone and I'm sharing from my system now, slideshow. So are you seeing the slides now?
It's booting to come up, ma.
Okay, fine. So according to the International Labour Organization and the WHO, occupational health is the promoting and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupations by preventing departure from health, controlling risk, and adaptation of work to people and people to their jobs. You have to get adapted to your work, and the job has to get adapted to you. That's just the simple English. If you are a tailor, the way you sit and do your work, the things that help you to do your work are not the same as that of a mechanic, are not the same as that of a medical doctor, are not the same as that of a lawyer. So you need to be adapted to your work, and the work also needs to be adapted to you. You have to understand it. We already know how we do our work in our workplaces. So you must promote wellness in all situations and in all occupations and get adapted to your work. If it is a work that requires that you stay awake at night, you must get adapted to that. If it's a work that requires that you are always on your feet, your body system will need to be adapted to that. If it's a work that it requires that you show empathy, you show concern, you are emotional about it, it also means that you get adapted to that. So that's just a simple explanation. That in all of this, health is promoted physically, mentally, and socially. And these days we add spiritually too, because some people may look very well, but some spiritual content may not be. So are we together? Are you seeing my screen?
Yes,
ma'am.
it's fully displayed.
Madam.
Can you see the screen now?
Yes,
Yes,
ma'am.
yes.
Yes, ma'am, I can say it.
Yeah, it's displayed. Thank you.
Okay.
You're still right too.
All right. So scope of occupational health: prevention of occupational diseases and injuries, promotion of physical, mental, and social well-being of workers, workplace hazard identification, assessment, and control, health surveillance and medical screening, that is pre-employment and periodic screening. We already know that some of these things are done, particularly in the oil sector, in the banking sector, and even in the government sector. They used to do it very seriously, and even in schools, admissions now, you must register with the health clinic, you must do some x-rays. Then ergonomics and workplace design. Like I've been explaining, each workplace is peculiar. You can see that tailors sit on stools. They don't rest their backs. That is how their own workplace is designed. Well, executives sit on chairs that have back massage. That is how their own workplace is designed. So each workplace has its own peculiarities. There is none that is same. Some workplaces, you will see tools all over the place. Some other workplaces, you see very cozy environments.
Hello?
That is.
Have we started?
Please join, we have. Are you not seeing the screen? Can you hear me?
We can, ma'am.
All right, okay.
We're waiting for him to respond. Some of us are saying it.
Okay, occupational health and safety is generally defined as the science of the anticipation, recognition, evaluation, and control of hazards arising in or from the workplace that could impair the health and well-being of workers, taking into account the possible impact on the surrounding communities and the general environment. That is occupational health and safety. You must anticipate, you must recognize, you must evaluate, and you must control hazards that arise from your workplace. There is no workplace that is completely safe. Even in an executive office, too much of AC can be a problem. So you must recognize what can be a possible challenge in your own peculiar workplace and take into account how that can impact you or impact. Do you have any questions? Is it clear?
Very well.
Very clear.
All right. The core principles of occupational health and safety are founded on the tenets or are fundamental tenets that guide policy development and practice for workplace health and safety. They emphasize a proactive, right-based, and system-oriented approach. A proactive, right-based, and systems-oriented, that you must plan ahead, you must always think ahead. Then it's the right of people to be safe when they work. That is what it means, right-based. It's the right of people. If you employ people, you must create a safe environment for them to work. So it is the right of people to have a safe environment, and it's the right of people to ensure they maintain a safe environment. The office, your employer can give you a safe environment, but you, the employee, can turn the environment into an unsafe place. So you have a right as an employer and you have a right as an employee to maintain safety at work. And there are systems that promote this. So you must take into consideration these core principles. Proactiveness, rights, and systems must be all on about to prevent risk and promote workplace well-being. In addition, all workers have rights. All workers have rights. Workers as well as employers and governments must ensure that these rights are protected. Once you engage someone, even as a domestic staff, the person has a right to be loved, right to sleep, right to food, right to humanity. So the same thing in the workplace. You have rights. Right to your right wages, right to a safe environment, right to career advancement, so many rights. There are so many rights. If you want to talk about rights at the workplace, that's another topic, but it's important that every employer will know that once you're engaging labor, they have a right, and they have rights to so many things. So occupational health, safety, and health principles must be established in the workplace. Such policies oftentimes are normally implemented at the national and enterprise level. If you employ people, you follow the national guidelines to wages. Maybe you give the minimum wage, give the right to holiday. These are national laws, national rights. And so every employer or every business or every organization keys into those national laws. Then you can have your peculiar laws as an organization as well. That is why they said you have them at the national and the enterprise level. A national system for occupational safety must be established. Like I've just explained, whether you are in the banking sector, you are in the health and safety, you must follow the national guidelines on employment. When you employ people, you train them, you give them rights to their wages. These are all national laws or even international laws that must be employed, must be adapted by organizations. And such systems must include mechanisms and elements necessary to establish and build and maintain health and safety culture. There's always prevention that is at the back of every workplace health and safety system. prevention first. Nobody wants to be involved in an accident and then you start running helter-skelter to address the problem that has resulted because of that accident. So prevention is the watchword in health and safety. Prevent. Like we always say, prevention is cheaper and better than cure. So a national program on occupational health and safety must be formulated and implemented. Social partners, that is the employer and the workers, must be consulted. That is why you have employer handbook, and those handbooks, they produce them as a result of consultations with the trade unions. Government will not just wake up and produce a document that will say, oh, this is our working conditions. No, they always discuss with the various trade unions. If it is medical, they discuss with their medical team. If it's engineering, they always bring in stakeholders to discuss. Then the overall labor organizations of countries or systems always contribute to development of policies and programs directed at health and safety. And all of these programs and policies must aim at prevention and protection. Prevention and protection. Continuous improvement of occupational health and safety must also be promoted. That is, things must be getting better as it concerns the health and safety of people while they work. So occupational health services covering all workers must be established for the development and implementation of effective programs and policies. So all workers must have systems in place that will ensure that those policies handed down to them are effective. Those programs listed in the policies are things that can actually be done. That's why maybe now there's something like a national health insurance scheme, so that some element of health cost can be borne by government. There's also the pension contributory scheme. These are all things that were not even there before. Your employer contributes a portion, you contribute a portion. These are some of the policies that promote workplace health, because some people, if you know that at the end of your retirement, there's something there for you to collect, it might help you to put in much more, particularly with this pension scheme, contributory pension scheme. It's just an example of some of the policies that promote people's well-being at work. I'm going to slide 9 now. So compensation, rehabilitation, and curative services must also be made available to workers. This is a very, very topical issue. This is particularly very topical. Compensation and rehabilitation. If you look at the armed forces, there was a recent agitation. There was a recent agitation of people who were injured in the war front, being abandoned, not being cared for, not being compensated. That video was online for some time. They were lying in some of the military hospitals with hands cut, legs cut, body parts cut off. So the question was, you sent us to the war front and we got injured, we got disabled, what is there for us? So I know in Lagos, there is what is called Armed Forces Rehabilitation Center. They built it there. So if such a situation arises, now you can't use the gun in the war front. Probably you can go and learn a trade, a skill. So some of them are into carpentry, into any of these skill acquisition activities. But that is in Lagos. I don't know which other part of the country that has such. Now, that is for the armed forces. What about for other workplaces? If you get injured or get affected as a result of the work you do, what is there as compensation, what is there as rehabilitation. These are issues that people often agitate about, but we must also know that it is a right of workers to know, and this must be stated in the policies and programs, that when such a degree of injury that reduces your capacity maybe by 100 or 200, or by 50 or 75. I am told that a loss of one arm is categorized as 25% loss, and maybe loss of two arms is categorized as 50%, then maybe loss of an eye, loss of two eyes. There is categorization of loss by percentage when a body part is affected, and the compensation that will suffice for such degree of loss is also clearly stated, or is supposed to be clearly stated in a policy document. So we need to understand this as well. Then education and training are vital for a safe and healthy working environment. You don't employ people and keep them static. You must learn how to move them higher in their career. Workers, employers, and competent authorities have certain responsibilities and duties to ensure that his workplace is safe and there's access to first aid should a situation arise that will need it. And such policies must be enforced. There must be a system of inspection in place to ensure compliance. I see most of this happening or working effectively in the oil and gas sector, but I don't see them in any other sector in the country. And I wonder why. Maybe we can discuss about it, and you may tell me why it is not working in other places, but it's so effective in the oil and gas sector. So what are the WHO rules in promoting occupational health and safety? I am on slide 10 now. So WHO sets goals and standards to provide technical guidance on occupational health. They promote workers' health through global plans of action on workers' health. They support member states in developing national occupational health policies and programs. They conduct research and risk assessment on occupational health diseases and hazards. They build capacity through trainings, surveillance systems, and information sharing. We know if you go to WHO sites, there are technical summaries on so many things, on education, on diseases, on occupational health and safety. So if you go through the WHO sites, you can read their own contribution to occupational health and safety and their roles they play in promoting occupational health and safety. They support member nations. Nigeria is always signatory to some of these statements and policies. And so we always sign into them. They build capacity. There are also free trainings by WHO, and there are also paid trainings as well. If you go through their site, you will see it as well. And they collaborate with the International Labour Organization to integrate occupational health and safety into public health programs. So you can see the diverse role occupational health and safety is playing in promoting, diverse roles the World Health Organization is playing in promoting occupational health and safety in the workplace. And the role of the International Labour Organization, that's what is abbreviated as ILO. International Labour Organization is ILO. So it develops the standards on labor. And some of their examples are the conventions 155, 161, and 187, which you can also get to know more details on the International Labour Organization site. You will get to know more details if you look through the International Labour Organization site. It advocates for decent compliance with occupational health conventions through supervisory mechanisms. It provides technical assistance to countries in drafting and enforcing occupational safety and health legislations. And it supports social dialogue among governments, employers, and workers on workplace safety. And it promotes integration of occupational health and safety into national and employment policies. So this ends the first part of this presentation on introductory presentation on occupational health and safety, session 1. So I will throw the class open now for discussion. I was particularly interested on that core principle on compensation, rehabilitation, and curative services, slide 9. So I want us to talk about this, what you think is right, or what you think, what do you think is best to do in a country like ours. So I'm going to stop sharing my screen. I want to hear your contributions on this aspect. Are we together?
Yes, we're
Yes.
together.
Yes, ma'am.
All right. So so I'm going to stop sharing the screen now. So I want us to digest the presentation and see the picture of Nigeria and occupational health and safety. What are your thoughts? What do you think we can do better, or what are we not doing right? So the floor is open. Thank you. So we have in class today Age, Ajara, Gondu Kenneth, and who else? Maybe we hear from Kenneth. I've not met him before. So Kenneth, can we hear your thoughts? Hello, Kenneth? Is he here?
Gondo Kenneth.
Yes, I want you to speak. Hand is up. Achanya, okay, you can talk, you can contribute while Kenneth is taking his time. Wisdom, go on.
Okay, ma.
Achanya.
Good morning, ma. Yes, good morning, ma. Yes.
Good morning. You
right.
can go on.
Yeah. Okay, ma. The network is disturbing me here, but let me see the best I can do. Can you hear me now?
I can hear
Yes.
you. Go on. Go on.
Okay.
We're hearing you.
Okay. Okay. Thank you. What I have to say about that is talking about occupational health and our country here, Nigeria, both the the workers and the employers, or even the labor organization, a lot of lapses that even the labor laws we are talking about and even the international laws we are talking about, they are not even working. Because if you are talking about the well-being of the workers, the well-being of the work, you are where your workplace, first of all, you have to take care of your workplace. Now, in doing that, the employer have to set up the place to be convenient for you. I'm talking about the aspect of the employer now. It's not maybe a personal work. I'm talking about aspect of employer now. So now the employer have to put a place in order for you to be convenient, to be conducive for you to work. In fact, there is nobody that will have a conducive atmosphere or a conducive environment for work that will not work efficiently or effectively. But we found out that even we are just managing to work. At times, you find yourself in a professional field or in a field or where you are working, they did not provide a protective, what is it called, for you to work. You have to use this meager salary they are paying you to get it for yourself, for your own safety. Those are the lapses I'm talking about. Then when you talk, the government will say, why do you talk? Or the employer will say, why do you talk? So the laws are not even working. So I think, anyway, I will still need to talk about the employer, because the employer have a vital role to play in the safety of the workers, so that the workers can, work conveniently or efficiently. Thank you very much. That is the little I can say, or much I can say.
Thank you so much, Wisdom. Thank you. I get you. I get your point clearly. So we want to hear from someone else. David Abraham, can we hear your views on this?
Okay.
Occupational health and safety in Nigeria. What are your views?
Good morning, everyone. One of my views is every worker should be entitled to life insurance. I believe there is a insurance policy that the Nigerian government have set in place over time to able to meet some of these occurrence within the place of work. And after maybe
what is going on?
Somebody needs to mute, please. Somebody needs to mute. Somebody needs to mute.
Hello, ma.
We can hear.
So
we can hear you. Go on.
Yeah. So I think one of the major agencies that could help in this is the insurance company agency.
There is no audio from my side.
That can be used to meet some of these things. So I think literally, like most of these companies, like the these road companies, engineers, like I want to use the instance of Julius Berger, where like 3 years ago, a family member who worked for them was sent off without a proper payoff. So, and this happened because during the course of one of these, they were working on the road, so an incident happened, and the person lost his one of his leg due to one of the tractor was working. So, but after the person was sent home, and he was not even properly paid. So I believe that if some of these measures are put in place, especially if there are laws that will guide these things, I think it will really help the workers' safety and then the workers' benefit after some of this incident, ma. I think that's a little view I have to stay on this, ma.
Abraham, yes. Okachi, Ochaka, let's hear you. I'll call you Daniel and Timothy. You will speak next. So after Okacha, Daniel will speak, then Timothy will speak. Thank you.
Okay. Thank you, ma. Good morning, ma. Good morning, class. So my views concerning these occupational health issues for our country, Nigeria, there are a lot of lapses indeed. And like you have mentioned, especially in the oil parastatals and then some federal government parastatals that actually take those things into serious cognizance.
Ochaka, what is going on?
All the others do not adhere to it strictly. If they do, not properly. And that's because what I see is our value system, I think, is really, really low. It's so low that we do not value the life of a human being. That is what I have seen in our country. So they feel there are a lot of people in line to take your place. So whatever is offered to you, you should see it as a privilege, which is unfortunate because it shouldn't be so. It's a very wrong mindset and is one of the things that drives this kind of attitude of not compensating workers well when they have health issues or disabilities and other things. So the value system, and then corruption is another thing. It still falls under the value system. It's the corrupt system, the leadership, the people that should actually enforce these laws, because the laws are there, but it's enforcement that is the issue. These things, if a worker now even decides that, okay, they will take up the issue legally for being neglected, forces come against them, you know. So at the end of the day, the worker is left at his own peril to do what he can to save his life, the little life that he has left, rather than go against the system that, because his employers have the money to bribe and settle, they will not give him his justice. So these are some of the challenges that Nigeria is facing. We have a poor value system, which has it wasn't really like that in the early days. The way we've crept into this lack of value, the sanctity of life, it's really amazing.
All right, thank you. Because of time,
Yes.
we've heard you. So you can bring down your hand. Daniel, let's hear you.
Good morning, man. Good morning, class. I will briefly talk about two issues, man. Number one is the issue of National Health Insurance Scheme. I think on paper, that scheme is very, very effective. But in practical, the reverse is the case.
Honestly.
Who is laughing? Why did you laugh?
No, he's saying the correct thing. That is why I'm laughing, man.
Okay, let him finish. We'll hear from you too.
When you go to hospitals, there are certain drugs that are designed for people who are under National Health Insurance Scheme, and there are better drugs that are designed for people who are not under that scheme because they are paying huge amount of money. So that is why I say that on paper the scheme looks very effective.
I think the climate is.
I think health is health. that you are working for a particular organization and they have registered you under that scheme, it is another way of helping you to work better. So I see no reason why the health workers, the health providers should be giving you substandard drugs. So I think there should be a particular body that will monitor these people, that will supervise them and see that the right thing is good. Maybe such bodies are on ground, but they're not doing their work effectively. That is one thing I want to talk about. And the second one is, I grew up, I met my dad as a civil servant and other uncles of mine who retired, and the government paid them huge sums of money, which they use in settling some of their problems and setting up particular businesses in their life, that up to this moment, some of us who grew up, we made those businesses and we are benefiting from them. Then the government brought something, a contributory pension, which somebody will work. At the end of the day, they will calculate your money in percentage and give you. These people will analyze how long we are going to stay on earth. They will pay you in bit, small money. And if that time they have estimated that you will die, the time comes and God has still kept you on earth. I've seen a case where some companies refuse to pay such people until they went to human rights. So to me, I think some of these policies or programs we bring in, maybe we copy from the Western world, we bring them here, but we first implement them the same way those people are doing it. I think we have to revisit such programs and policies and see how we can make them more effective for the Nigerian workforce. Thank you, ma'am.
Thank you so much, Daniel. I think that's Daniel who just spoke.
Yes, ma'am.
Yes. Timothy. Daniel, bring down your hand. Timothy, let's hear from you.
Good morning, ma'am. Good morning, class. I think, yes, the core principles of compensation.
Yes, we're hearing you. Go on.
The core principles of compensation in Nigeria is more often said than done, because as one of my mates has just said, most of the times we see those things, or we don't did the reality of it on ground. I was disturbed, and maybe I will put this thing out now. You that are learned above us, that showing us the way to follow now, you know WHO, you can call them and liaise with them, so that if possible, they can come to such countries and then begin to rescue the situation on ground. Or else, we are going to a worse situation that most of our citizens will not be able to go through again. That is what I have to say on this, because they are on paper, they have not done. So you that are above us should liaise with those people and then co-opt a way that this thing can be solved once and for all. Thank you so much.
You are a stakeholder. You are a stakeholder, and you can write to WHO. WHO receives documents from anybody.
Okay.
So you can write. Yes, you can write to him.
Okay.
You can write to the organization.
Okay, ma'am.
Just go to their site. You see somewhere you can send a comment, a complaint, or anything. So if you access their site, you will see where you can write to, and somebody will answer you. And they have an office also even in this Makurdi, Benue State. There's an office here. You can go and drop your complaint there. So we're all stakeholders in this system. And if you see something and I have not seen it,
thank you so much.
And you can project it and bring other people in, and the voice will be louder. Thank you. Yes, Maxwell.
Thank you.
Good morning, ma'am.
Good morning.
Yes, my thoughts on occupational health and safety. You know, occupational health and safety, the truth of the matter is that in Nigeria, it has completely been neglected. And, you know, occupational health and safety is people neglect it when they are working, but it's one vital pillar of our national sustainability. Even the economic productivity, it connects to it. So I think that we have to improve on our legal reforms, institutional strengthening, and data system. It will shock you that even the institution in charge with the handling of occupational safety injuries, they don't have a comprehensive data. And then we need to do massive awareness. But the question is, who needs to do all of these things? It starts with us too. Because there was a time I worked in a factory, 60% of the injuries we had were avoidable. So, like just like public health, that occupational safety, we need to take it the same way public health is done. So I think that's the little I have to make in this topic, make a contribution in this topic, man.
Okay, thank you so much, Maxwell. Bring down your hand. So we hear last from Alexis. Alexis, you have the floor.
Good morning, ma.
Hello, morning.
My own contribution is a practical one. Yes, my own is a practical one. You discover that there is no awareness in most of the and offices, all these startups. There is no awareness. In fact, to a point that you will discover an event will occur. Let's say a crash, an accident occurs involving a staff. They will start looking at the kilometers in which this person had come. They will start looking at whether they have sent a first information report. When did they send the first information report? All these things will be put in place. Immediately, you do not send first information report within a particular time. You see them, they will now knock you out. They'll say, we are going to take yourself. These are some of the things that happen in most of these agencies. There is no awareness. Nobody is ready to come up and say, come, this is not correct. So implementation is a problem of all these rules. Well, if there is a way we can make up, then that would be the best for the society. Thank you.
Thank you, Alexis. I can see Usiagu's hand. We have 4 minutes for this session to end. So Usiagu, let's hear from you.
Good morning, classmates, and good morning, madam.
Good morning, sir. Let's hear from you. Yes, good morning.
Mine is on the biased nature of leaders and administrators. Those saddled with the responsibility of implementing some of the safety. We have one of the best safety rules and regulations. Unfortunately, in the multinational companies, which have been part of it before now, like the oil and gas exploration, some international companies, they abide by this rule because they know the legal implication of it. But here we are, our own people will be marginalizing us. Our own administrators, our own system that is supposed to protect the right of the workers are not doing that. They are so biased. Also, due to hunger and lack of jobs, like Chaka said, you see people being threatened by, if you report, they will get you out of the job and out of the way. And because you are looking for work and you don't want a family, you go and manage, even when they don't give you. But in oil and gas sector, there's no management. You don't have your PPE, you don't have your protective equipment, even the work is not safe. The rule is oil and gas and some of these multinational, if it's not safe, don't work. And nobody will penalize you. But here in our own national companies, our system, our government agencies, our workplaces in civil service, and Nigerian companies, who cares? They don't implement, they are biased, they are so biased towards the fellow human being, and that's it. So these are the challenges, and until those orientations are, like you said, we're all part of it. If they give you a job, and if, let's say, hey, somebody is offering you a system where you come and work and you need certain equipment and all that, by the time those equipment are not there, you walk away. The next person comes and walk away. The next person comes and walk, and they can't get somebody to work to do the job. Then what do? They will now be forced to implement this thing. But because of lack, because of hunger, because of the system that is so biased, they will not. They will just get some other person and replace you. And that's the stake I have. What I have to say.
All right, thank you. Yes, thank you so much, Osiago. So you people were discussing the poor state of occupational health and safety in Nigeria. And having brought out all of this, having brought out all the issues, you are now studying this course, this postgraduate diploma in environmental sustainability and occupational health and safety. It's not, it's an integrated part of environmental sustainability. So having listed all these issues, what is the way forward? Because we have seen problems. Where are the solutions? Hajara, do you have something to share with us? What are the solutions if you were put in place to address the occupational health and safety issues in Nigeria? What will you do?
Okay, okay, ma. First of all, if I think I will have to. What really is a area of concern to me is the National Health Insurance Scheme, which is actually a fraud in Nigeria. But if I am given the opportunity to address these issues, I would like to make an equality in that organization, in the area whereby it doesn't matter your grade level, it doesn't matter your contribution to HMO, everybody should be given equal opportunity. That's to say, at times you go to the hospital, they might end up giving you a drug. You might just be entitled to maybe malaria and typhoid tests. There are other tests that your HMO doesn't cover. But in area like this, if the issue, it needs to be addressed, it has to be covered in all cases, because the health sector is one of the sectors that is really affecting the livelihood of, if not all, Nigerian. That's where, because if you are not rich and wealthy, there are some areas of health of which you cannot access. So I think I will address that, giving equality to every individual, regardless of your grade level, regardless of the organization you are. Once you are a contributor, you are entitled to total or complete health check. Free.
All right. So that's what you will address, the health insurance scheme, right?
Yes, ma'am.
Yeah, but health insurance is targeted at treatment. But the core principle of the core principle of occupational health and safety was always, we listed it as prevention and protection. So you are addressing treatment angle.
Okay.
You want people to get sick and get treated, while occupational health and safety is saying prevent people from getting sick, protect people from hazards. So I'm wondering where your own target will help the system.
Okay, and also
because look at the core principle. The core principle is prevention and protection. And it's only people go to hospitals only when they get sick. And that's where the health insurance comes in.
Yes. But you see, ma, when it comes to prevention,
will you still work? Will you still work on? Yes, okay.
Okay, when it comes to prevention, it's not government offices. There are most offices, private offices, that don't take preventional measures. I remember while I was working, there was no like a health cover, like a preventive measure. You are exposed to risk, and which is an area, despite the fact that it's a private sector. So one major sector in Nigeria that are exposed to all these health risks is the private sectors, which are the main people that don't have good health insurance cover.
I saw a hand up. Is Kenneth here with us?
It was Maxwell, sir. Ma.
Yes, but I want Kenneth to speak. Is he here with us? Or he's gone? He joined, but not joined. We have reduced to 12. We were 15 when we started. Where are the other three?
Morning, ma.
Good
Good
yes,
morning, ma.
Kenneth, good morning.
Good morning,
Morning. Good morning, Kenneth.
ma.
Let's hear you. We're discussing a topical issue.
Network was not good at my side. That was why I couldn't contribute.
But are you able to contribute now?
Yes, I can. You see,
Okay, let's hear you.
The issue of occupational hazard in our workplaces is very difficult. The employer has not provided a conducive working environment for us. A worker will come to work and will not even have an office. Will have to be moving from one place to the other and like that. And for us workers, with our meager salary, we cannot create a conducive environment for us to work. Like other of my classmates were talking about, issue of hazard, taking care of us as a hazard. You see, the government, I don't know whether there is a labor organization in Nigeria, because considering how government is treating workers in Nigeria, one has to wonder whether there is labor organization in Nigeria. You look at the salary structure in Nigeria today, they say take home, and these monies cannot take us home, cannot take care of, and that has empowered corruption in Nigeria, because one thing about when you retire, what becomes of your life? So when one is made a director or head of any agency or whatever, he or she tries to make sure that his or her retirement benefits are taken away by himself, so that when you retire, you don't have any problem with government, whether government care about you or not, you care by yourself. So that is what is happening today in our workplaces and in our organizations and whatever. So the labor is not there to help us. In most of their negotiations, I don't know, they are not fruitful. So that is my take on the issue of occupational hazard. Thank you, ma'am.
Thank you so much, Kenneth. And Age Tekora, do you have a contribution for us?
Hello, ma.
Yes.
I had network issue, but I've just joined again. This is Daniel, ma.
Okay.
Talking about what one can do to prevent these injuries or this occupational risk. I think if I put in place, if I'm in the position to handle such, I think the first thing I would do is corruption, to tackle corruption. I think that is the primary thing there. I had an experience as I was working with one health organization in the FCT, and there was a day we went out to check some of these facilities like hotels and hospitals. So we got one got to one hotel. In fact, the hotel was extra neat and clean. There was no cobweb anywhere. They had an incinerator. You could not see any dirt around. But when we checked the staff head certificate, we now discovered that 2 of the staff there had expired certificate. Like for 2 months, they were supposed to go and do another checkup. They didn't go, 2 staff. And based on the recommendation there, then 1 staff was supposed to, the fine that the hotel was supposed to pay for 1 staff was 750,000 naira. And so the 2 staff, they were to pay 1.5 million naira. Then a call came in. As we were dragging to write down the receipt, a call came in. They gave to my boss. He answered the call for like 5 minutes. And after that, something else happened, man, which there was a brown envelope that was given to him that did not contain such amount of money. He now collected it, and that was how that case was closed. And so those 2 staff, maybe they continued to work there with the head hazard. They were not screened. They were supposed to go back to the hospital and be tested and be issued another certificate, which that was not done. That is why I said, if I am put in place to checkmate such thing, the first thing I will tackle is corruption. I think that is basically what is eating the entire system, the entire situation. That is what is killing us, man. So that is what I would do, the first step, man. Thank you.
Thank you so much, everyone. But are you sure you'll be able to stop corruption? So it's important for us to begin to think of practical and possible and easy to do ways. Corruption is something even Buhari could not stop, and now he has gone to join his ancestors. And when you think of things that you can do that are more practical, like you've been discussing here, many of these situations are arising because people are trying to provide for themselves. Somebody said there's no PPE. If you turn and always picture the oil sector, people who work in the oil sector, I think things like corruption are far from them, because their pay is good, they're taken care of very well, everything they need to work is provided for them, or most of the things they need for work is provided for them. So the system has provided a situation where stealing or embezzlement will be very far from their mind, because you have everything you need to work. So I was hoping that our discussion would be on preventing or protecting the worker more than the system thing we're talking about. Nobody can stop corruption as far as Nigeria is concerned. Even Buhari came, he couldn't stop it. From the analysis we have, the system was even the worst. So corruption is a hydra, is a monster. So our solutions to things should not be administrative first, or should not be should not be what may be impractical to do. Because if, as people are employed, somebody said you come to work and you don't have a desk to sit on, how do you want that worker to work? So you need to have things that will make a staff comfortable at work. And as we speak, this applies to all of us. Sometimes in our very own homes, we are practicing occupational injustice, because the people we engage to work for us, what are their own working conditions right in our own homes? So we're not only addressing people who are in white-collar jobs. Once somebody picks up a job, whether it is a street sweeper, whether it's a domestic staff, whether it's an executive, all those labor rights apply to that person. So what do we do, or what can we do? That's what I was expecting to hear, that assuming you want to contribute to the voice of occupational health and safety in Nigeria, what will you propose? Not corruption. You can't handle that. It's beyond you. It's beyond me. It's beyond all of us.
Excuse me, ma.
Yes.
Ma, why I mentioned that, you have talked about providing those things that will make a worker do his or her job well and do it in a less risk applying, situation. Now, I can tell you that that is the office I work. I've been privileged to look at the budget at least for like 2 years now. Last year's budget and this year's budget, I've seen it, where like safety boots, each year they put money for safety boots and things like that. And if you can come to that office right now, the safety boots that you can count on ground, they are not up to 10. This is an office with about 107 staff, and majority of them are scientific officers. That their job, most of the times, you see us working on the field. Now, these things are not provided, but the leadership there, year in, year out, they put these things in the budget, and the money is being released. Even if it is not released on time, or it is not released completely, at least it is being released. So why not provide these things for us? As I'm speaking to you, if you go to that very office, there are no toiletry facilities there. That is another thing. Two, in the very office where I sit, we are about 15, and then you have 4 desks. You see some people hanging under the trees, but in the budget, these things are provided, and they are not. When the money is released, they are not made available for us. That is why I say the first thing, yes, we cannot.
Okay, I get you. But
tackle corruption. But then,
so you, the staff in the office, what have you done? What have you done to bring out this pain you're feeling?
Man, I cannot speak. If I cannot write anything unless, just like my other colleagues stated, because there is hunger, no jobs. If I speak, it's the issue.
All right, that's okay. So Akumba, we have not heard your voice today. Are you part of this discussion going on?
Yes, ma'am. Good morning, ma'am.
Good morning.
As my other colleague has already said, what is causing the organization health safety that is not effective in Nigeria, we lay that all into poverty. Because poverty have taken place in every organization now, in which most people focus on the job that they will get. They do not think of the safety of themselves, and they can't request to know much about the safety of the organization, and then they jump into the organization without knowing the safety. So all in all, I would say that it's poverty that is causing all this. Thank you.
Had an exhaustive discussion. Yes.
Ma, can I say something?
Okay, go on.
Yes, ma. Thank you, ma, for this opportunity once again. Like from the first time I spoke, after speaking about the system, I still talk about ourselves. Yes, there's a way we can prevent it. This, you are working, you are not working to die. You are working to live. So if the system fail, do you follow the system to fail for this, for your own, for the risk or for your own life? So no matter how the meager the salary is, you do your best you can do. Like in my office, in my office, you know, when my boss want to retire, he want to pack his things. I say, no, sir, it's not possible. He used his personal money. Oh. He used his personal money to buy, to get AC, to get table, chairs, and other things that he will need to make himself comfortable. So when he retire, he want to leave. I say, sir, you are not going with a dime. He say, why? I say, this is what I will inherit from you. And I collected those things without paying him anything, and he went happily. The last time we invited him, he visited. You know, I took very good care of him, and he was happy. Now he make those things available for himself. You know, both his lab coat and everything he's using, I collected them because I know me, those my money cannot buy those things. But if you have the capacity, to take a little from your salary and, you know, protect yourself, you do it so that you work longer and you live longer, especially if you find yourself in the area that is there is risks like hazard and all of that. Use your money to get what you will protect yourself so that you can work longer and live longer. Thank you very much. That is one way of protecting yourself.
Yes. In fact, thank you, Achanya. You have said it all. It's really very important that safety first. And because government has not also not take care of yourself, you have to think about yourself first. So I appreciate the contributions by Achanya. I'm seeing people joining now. I've seen Mustafa and who else? Somebody has joined. Mustafa, were you with us from the beginning? Hello? Mustafa? Are you still hearing me?
Yes, we
Hello,
can
Am
hear
I
you,
still
ma.
being heard?
Mustafa
Yes,
was
yes, ma.
complaining of network issue.
So I want us to look at the perspective of this last speaker who just spoke with us. Or maybe we start from the second but the last, who said that in the budget there is provision for things to be provided in the workplace, but they are not provided. And a second scenario was a staff who used his own funds to give himself the comfort he needed to work and do the things he can do. Yes, our country, Nigeria, is a peculiar country. Our own situation is peculiar, where money should be deployed. Oftentimes it is not. But you will not put yourself at risk because you are working. Know that the moment you lose, the moment you are lost, that very hour, somebody is going to replace you. So it is important that you do all you can to prevent yourself from being affected by the work you're doing. If you can provide for yourself, do provide for yourself so that you are safe while at work. I was telling you the percentage percentage of losses that is accrued to a loss of a body part. But I think 50%, 25%, 75%. And compensation comes in that category. And before you even process the compensation and get it, that's another story. So why do you want to go through the pain of chasing a compensation? Because you've lost ability, or you have not become disabled. Wouldn't it be better to prevent or to protect yourself? If a system fails, will you be part of a failing system because the system has failed? So where things are not working well, you don't flow with the system. And where things are working well, you flow with the system. The laws are made. Nigeria signs into them every environmental law. Nigeria is signatory to it. But you can see our own situation. Every occupational law, we're signatory to it. Most of these laws were signatory to it as a country. But you can see where we are. And so we need to take responsibility of ourselves. We need to promote environmental health. You need to promote occupational health. You need to be safe while you work. If you don't have a chair that is giving you comfort, you could save and buy a chair and sit on it and give yourself the comfort and do your work. Should you move, you move. You can see some places when people are going, they remove the things they brought, like the example someone shared with us. But that other person was kind enough to leave it behind because that person needed his comfort. So where the system is not working does not mean you will remain where, because you expose yourself to the risk. The system will not provide for you when the risk harms you. So we are trying to encourage a safety culture in all of us. You must think safety first, prevention first, protection first, not when harm has come or damage has come. You start looking for where to go to. The insurance system doesn't help. The compensation system doesn't help. The justice system doesn't help. So where will you now run to? The medical system doesn't help either. You have systems that should be helping, and all the systems are not helping, but you can help yourself. So if you are able to take care of yourself, it is better for you. So as you walk, think about your safety first. And also, the people that work with you, think about their own safety. Sometimes you are in an office with someone and the person is playing a loudspeaker on this phone or something like that. It's not nice, it's not good. So the workplace should promote social wellness, psychological wellness, mental wellness, physical wellness in all ramifications. Are we together? Am I being heard?
Very well.
Yes, ma.
Okay, so I think this session we have discussed it extensively and exhaustively, and I believe you have been able to understand the point where you play a role in promoting occupational health and safety. First of all, for yourself first, and then for the next person working with you. But I'm seeing Mustafa joining us, and he also needs to contribute so that we hear his own views before we call it a day for this first part of the lecture. Hello, Mustafa, are you with us? Who else hasn't contributed to this discussion?
Akumba.
Akumba, all right, yes, Akumba, let's hear you.
Ma, I have contributed, ma. Sorry, I made mention of poverty the other time.
All right, so I'm still going back to slide 9. We talked about compensation, rehabilitation, and curative services. And okay, we're now on slide 10. Set global health standards, promote workplace safety, support member organizations. No, it's not the slide. Yes, slide 9, but the second point, education and training. So when I talk about it, education and training, how many of you here have undertaken any training in basic first aid or workplace first aid?
I've been out of it in my workplace.
Are you a certified first aider?
We do it on skeletal when any occasion, any time it calls on us to do. So that's how we do it.
So you are none of you has gone for a training on basic workplace first aid?
I have not done. I've not gone on it.
The first aid training I had was when I was actually in primary school as a Red Cross member then.
Wow, that's many years ago. So you see now that
mine was my NYC. Red Cross.
How
yes.
far? When was that? How long ago? Who talked about NYC? How long ago was that?
Okay, it's me. It's 8 years ago.
Okay, so at least
It's
yours
me,
is
8
recent.
years ago.
So
Yeah.
now, if you're going to learn about occupational health and safety, it's important also get trained in basic workplace first aid. And also understand or get education on the various types of injuries that can happen in the workplace. And the signs that promote workplace safety. If you see yellow, what does it mean? If you see green, what does it mean? If you see red, what does it mean? I remember in my first class, I think I showed you some of those signs, workplace safety signs in one of the classes.
Yes,
Yes, ma'am.
Yes, workplace safety signs. If you go to any of these telecoms mass sites, you see a label with all the signs there, showing which one is a radiation, which one is a electrocution, which one is death. So it's important that you also build yourself up in getting training. And I told you, there are free trainings online. There's a free training on WHO site for environmental standards, and you are certified free, but you do it online. There is basic first aid training online. You don't need to pay. So there's need for you to build capacity in these areas. Maybe government cannot train you, government cannot send you to school, but as someone who is undertaking training in environmental sustainability or anything related to the environment, safety and health are not far from it. So try to reach out to these very important sites that relate to your work. United Nations, United Nations Environment Program, International Labour Organization, WHO. There are free trainings there. You do them and you get certified. And the certificate, you get the knowledge, you get the certificate. Even basic first aid, you can get trained online. You can watch the video, you can know the steps to take, the ABC of first aid, the types of workplace injuries, and the type of responses, emergency response, evacuation techniques, and all of this. At this level, you don't need to go to a paid training, maybe except probably you want a very advanced one. But from your comfort zone in your house, you can build your capacity. And through YouTube, I have known people who have learned how to bake through YouTube, learn how to sew through YouTube. So you, as environmental experts, can also learn some of these very important skills that you need for your workplace online, and they will help. So I want to encourage you to begin to watch, see how you can build your capacity by training, education and training. They said education and training are vital components of safe, healthy working environments. So the basic first aid is important. Knowledge on types of workplace accidents, knowledge on exit and evacuation during accident and emergencies. For us in this country, we don't have high-rise, maybe 20-story, 30-story building complexes as offices. But in advanced countries, they have such work environments. How do you evacuate when an accident occurs in a 20-story building or in a 30-story building? How do you evacuate? So you need to know all of this. And you can build your capacity, like I said, personally by enrolling in online trainings, which most times are free. There are a few that are paid for. And the essence is that you should build your capacity yourself, because training has become very expensive for organizations. So people who have the skills and are willing to share have developed models and have put it out there. At least there's their own contribution to humanity. So I will encourage you to please look at these various sites and see what trainings you can build capacity on. Do you understand me?
Very well,
Yes.
ma'am.
Are we together?
Yes,
Yes.
ma'am.
So I will follow up on you, and that will be an assignment. You show me the evidence of an online training you have enrolled before the end of August, which is exam time. Let's see how much of that you can do. Do you understand?
Yes, ma'am.
Yes.
Okay, so now is question time. So I'm throwing the floor open if you have any questions. Yeah. Questions. The floor is open for questions. Hello.
Hello, ma'am. We are with you.
You don't have any questions, right? So
now.
Professor Kefan said he will send some assignments before the week is over. But my own is for you to see which of the online trainings you can enroll in. Some are 3 weeks, some are 2 months, some are 2 weeks. But it's important to do them. And like I said, you just sit in the comfort of your house, and it's self-paced. You can learn it in the evening, morning, whatever time technology has brought things closer to us than we think. So I will want to end this discussion today. We'll take it up at 1 p.m. again. Why? Because my battery is running low. There's no power. I couldn't get to the university earlier than now. So we'll see at 1 p.m. Is that okay?
Yes,
ma'am.
ma'am. Thank you very much.
All right. See you then.
All right.
Okay,
Bye.
ma'am.
Thank you.